So, welcome everyone. It's so just comforting and encouraging to share space with you all. This webinar was initially, you know, envisioned to just create a group hug and a response to the impact of the executive orders on the HIV community. We have received such an overwhelming response, and we're grateful that you're here. I think it really shows um, how important this is. I am also, my name is Martha Cameron, and I wear a few hats, one of which is working with the international community of women living with HIV that has partnered with Positive People. Together, we are co-funded to uh, really fight stigma and create a safe space for people living with HIV, to be on. However, we can never ever work in isolation, and I'm really, really privileged to be a part of a network that is a network of many HIV networks that respond to policy and advocacy that is related to the HIV community. Um, and the organizations that co-sponsored this webinar are showing on the screen, starting with the People Living with HIV Caucus. That is our network of networks. And I'm really privileged to have our chair person of the People Living with HIV Caucus, our new chairperson, Vanita Ray, is on here. I think our outgoing chair will also be participating, but we did have a new administration for the caucus in Vanita Ray and Michael Elizabeth Webb. So really excited for them to be here. And then we have Zero, the Reunion Project, the Positive Women's Network, National Working Positive Coalition, um, um, National ARC advocacy that are all networks serving in some form or fashion folks living with HIV. And then, of course, our speakers are going to come from AIDS United and the Collier Collective. And we will introduce those as we get started. So, without wasting too much time, I would, want to go ahead and just get started. So I'll hand over to my co-facilitator, Barb.
Oh, thank you so much, Martha, and really appreciate your setting up this opportunity for a group hug. It seems like we had over 600 people who felt like they wanted to come into this space and be together. And that right there is one of the most beautiful things that I have seen in 2025, because it feels like we are getting ready to enter the 80th week of 2025. It has been quite a year already. And as we have always known in our HIV community, that our survival is dependent upon each other. And that in the early days of HIV, the reason why we were able to survive and thrive and do as well as we were able to is because we had each other, and we held each other up and lifted each other up and supported each other in some of the most difficult times. And we know that based on the chaos that has happened, that we are unfortunately in difficult and really uncertain times again. And I can't imagine a better group of people to come together and to talk about what we believe is going on. Even I'm not even going to say what we know is going on, because I think a lot of it is open to interpretation. But mostly to think about how we continue to support each other at this time and in these spaces. So welcome, everyone. We're going to be talking about the executive orders and the funding freezes. We have some subject matter experts who are going to then share what they and their organizations are doing, both around policy and advocacy, but also around protest and rebellion and resistance and mental health and self-care. So this is meant to be a community conversation. Um, and really, we just want to hear how people are processing where we're at and how we can continue to move forward in future conversations to support each other. Um, Martha originally had said that she thought there would maybe be about 20 people on this call. The fact that over 1,000 registered means that we indeed come together in ways that are necessary. And Martha, thank you for holding this space, and thank you to the partners for going ahead and offering this space as well. I should introduce myself. I'm Barb Cardell. I use they, them pronouns, and I'm the program director with the Positive Women's Network USA. I'm also a member of the HIV caucus, and I am so glad to be with you all here today. Without further ado, I'm going to actually go ahead and talk a little bit about our purpose today. We really wanted to take a moment to both lift up and share common knowledge about the recent executive orders and the impact that they will have on people living with HIV, as well as communities that benefit from prevention measures around HIV. We're going to talk about the implications. We're going to talk about stigma and community support. And we really welcome both people in the United States and globally to be a part of this ongoing conversation. We are going to have a brief presentation by Bill and Drew to kind of level set what our understanding is. And then we're going to open it to a panel of, as I said, community advocates and leaders who are associated both with organizations, but also with advocacy efforts at the state and the federal level to talk more about both how they are doing themselves, what their organization is engaged in, and what they envision as future steps as we come together and collaborate as we move forward. So without further ado, as Martha has said, I'm going to go ahead and get ready to pass it over to Bill. Bill McCall advocates on behalf of healthcare policy, harm reduction, and criminal legal system reform issues, and is the senior consultant with the Collier Collective. And Bill, I could go ahead and introduce you for many, many more minutes, but I'm going to actually, if there's anything that you need to add, please do so. And then we'll go ahead and we'll pivot to Drew once Bill has kind of level set for us with the executive orders. And Drew is an HIV and drug user health policy expert with both lived experience as well as a decade of experience working in policy, advocating for organizations who serve people living with HIV, and is the director of advocacy with AIDS United. So Bill and Drew, thank you both so much for being here with us today. We really look forward to what you're able to share. Give us a little bit of information, some facts, and then we're going to go ahead and be able to open into our broader conversation. So without further ado, Bill, I'm going to turn it over to you.
Thanks so much, Barb, and thanks to everybody for the invitation. I am also grateful to be in community with everyone here. It is a wonderful group, and I'm very pleased that we've got the opportunity to provide some information for you. So this started off as primarily being about the executive orders, which in fact underlie quite a lot of information about the lawsuits and all the various things that are going on. I am going to go on ahead and give an overview of the executive orders, what's going on with them, and then I'm going to talk a little bit about the concept of impoundment, which is a lot of what underlies some of the freezing of funding that we've seen going on. So it's been a real concern. Drew is then going to talk a lot about the funding freeze and particularly PEPFAR and USAID. And then both of us will come back and talk a little bit about action steps that are either ongoing or that we hope that folks here will consider taking. So with that, let me go on ahead and get started. Executive orders are basically orders that are pronounced by the president in order to sort of guide how the administration is implementing the administration's policies. With that, they're not unusual. There are a lot of executive orders that have been promulgated all through the through previous administrations, the Biden administration notably had well over 100 executive orders. All of those were actually repealed by the Trump executive orders, also not entirely unusual as administrations come in. What is unusual is that the aggressiveness of the executive orders and the breadth of the executive orders start to reach into areas that aren't really typically used for executive orders. And basically, before I start, I want to say one thing really quickly so that people understand something. The executive order really is just about the administration itself, how it is operating. It cannot override actual law, either at the federal level or at the state level. It cannot immediately change regulations. There has to be a process through which change is accomplished through regulations. And I think one of the things that we have seen with these executive orders is that in many ways they go well beyond, attempting to make changes to the law or to regulations. And I feel like most, if not all, of the executive orders are going to be challenged in some way. So one of the things I did, one reason I think people were interested in hearing from what's going on is that Collier Collective put together a tracker, and uh, I think it would be great if folks can. I'll try and put the tracker right now into the chat here. Um, so let's see. I think I've just got hosts and panelists up. There's everyone. All right, we've got the chat enabled. There's the tracker, and one of the things that's nice about this tracker is it will allow you. We're adding the executive orders as they're coming out, and it will allow you to actually read the executive orders for yourself. I do want to talk primarily. Well, I'll just mention there are a number of executive orders that are specifically about health. I just want to note that one that really alarmed me was that there was an executive order put forward on January 20th to withdraw the United States from the World Health Organization. I think that this goes towards issues that we're starting to see pop up with the nomination of RFK Jr. To be the Secretary of Health and Human Services. Unfortunately, he has a very strained view, I think, of the public health system. And I think also one of the things that's happened is because of COVID, public health in general has come under attack as conservatives have sought to open up a lot faster and wider than public health officials thought was safe. So we've got a lot of that starting to bubble along. And I think seeing things like a withdrawal from World Health Organization is exactly that. One of the most alarming areas that they have decided to move into, though, is around transgender issues. There are two really specific orders around transgender issues. And basically, they are attacking the concept of gender as being something that they want to say that gender is basic and immutable, whereas the scientific evidence and basis, we know that that gender, in fact, occurs along a scale, and that people are that there are issues around gender that we can provide better health for. So the two transgender orders are protecting children from chemical and surgical mutilation. That one actually came out on 28th of January. And the other one is defending women from gender ideology extremism and restoring biological truth to the federal government. And you can see in a lot of ways this really plays off of what they found to be a campaign issue. I think the public broadly has not really had this same awakening, I guess, around transgender issues that they started to have around LGBTQ issues. And one of the things that's very concerning, frankly, is that there seems to be a very concerted effort to move backwards, really in accordance with some of the supporters, the relatively religious Christian right supporters of President Trump, but also is somewhat in line with this what I think people are referring as to the manosphere, that there's a pushback around what men and in particular white men are seeing are feeling as a loss, I guess, of privilege, and that's been a real problem for us. So the second one that I referred to basically states sex shall refer to an individual's immutable biological classification as either male or female. And then actually that order states that it has to be specific to the time at conception, which has led to the observation that actually they've just declared everybody to be female. That's, I guess, a little bit of humor in the midst of all of this, but it's a real danger to folks there. I'm not going to go through all of the pieces on protecting children from chemical and surgical mutilation, other than to say that it's aimed at people who are 18 and younger, so basically under 19, and that it basically publishes, calls for agencies to rescind or amend all policies around the WPATH, which is has set up standards of care around World Health. It's a real pushback, and people are already using it to try to get into schools, and that is a concern. I'm going to come back to the thing I said. This has changed neither the law, nor court orders, nor regulations, and we definitely urge people to sort of push back on that. A couple of other quick things I'll mention, immigration in particular, and there are a number of executive orders around immigration, particularly stating, that they're declaring a national emergency at the southern border of the U.S., that they're allowing the military to police or seal the borders, and then, quote unquote, protecting the meaning and value of American citizenship. They are trying to essentially reinterpret the 14th Amendment to state that the government will no longer recognize the right to citizenship for children born in the U.S. to undocumented immigrants, and then that these and then deriving from these executive orders are real concerns about how immigrants are being treated, including in health facilities. Things like the Ryan White program and the federally qualified health centers that basically have been allowed to use to serve undocumented people are concerned about whether that's going to continue. Again, right now, I think that there are a number of suits that are being prepared, and we're going to have to sort of just continue to move forward on that. I'm not going to talk about PEPFAR because Drew will do that. I do want to note that there are a number of other EOs that are of concern, including ending illegal discrimination and restoring merit-based opportunities. So this is aimed at this concept of DEI. I think that flowing from that are a lot of concepts around, and one of the things that we're seeing is that a lot of agencies have responded to this by getting rid of DEI programming. This I think is obviously a major concern, particularly because, and there is a lot of irony that, a number of people seem to be being installed at the top levels, primarily on the basis of their connections or, their ideology. It's clear that they're not even practicing merit-based for folks who are at their top levels. And then finally, I'll just mention they did establish this Department of Government Efficiency, which people are referring to as DOGE. I will say I know that there's likely a lawsuit coming out even today to challenge DOGE's effort to take over Treasury. One real concern that we've got about that is that it gives access to people's records, and obviously with concern about figuring out whether people have HIV or things like that. That's a concern. And honestly, it's none of this is mentioned. So I think that is where I'm going to stop on going over the executive orders. There's a lot in there. I think Almost all of them, as I said, are going to be challenged. This is not normal, and this is something that's I think is going to be a real concern. Um, I do want to take a minute to mention impoundment, in part because that's kind of at least with in relationship to the funding freeze that Drew is about to speak about. It's an underlying concept that also is impacting the lawsuits, and that is so impoundment is basically the act of the president basically declining to spend funding that was appropriated by Congress. So the Constitution basically gives Congress the power of the purse, but the president is in charge of executing the law. And the Trump administration basically believes that it is um, unconstitutional uh, for to be prevented from stopping funding if they believe that if they believe that something shouldn't be spent. This is actually a really well settled constitutional question. They're really, it's been decided a couple of times that if Congress appropriates, then the president must implement. And in fact, this all came to a head under Richard Nixon, who also claimed the right to impoundment. And Congress ended up passing the Impoundment Control Act that basically says that the president can't block congressionally approved funds to programs without the permission of Congress. There's a process by which they can take 45 days to ask Congress to review something, but if Congress declines or once they're past that time, then they must actually do the implementation. So that's impoundment. It's something that you'll hear a lot about, and it's a real concern. I think I'm going to go on ahead and stop there. I feel like I took a little long there, so I'm going to turn this over to Drew and to talk a little bit about where we're at with lawsuits and things like that.
And actually, Bill, before you turn it over to Drew, I'm just going to hop in because there was a couple of questions in the chat that I want to make sure we clarify.
Oh, sure.
Yeah, we have Kara who says, for clarity, any healthcare providers who are denying care to trans kids in accordance with the executive order are making the choice to do so and are not doing so because it's actually required. And maybe if you could even tie in the New York Attorney General Letitia James's comments about age discrimination, that would be good to kind of clarify that point.
Yeah, so I will also defer a little bit to Drew on this, but what is going on here is that first of all, there is a temporary restraining order on this, so folks should feel free to act normally and to continue to provide services. The temporary restraining orders, well, Drew will get to this, but they apply nationwide and to all programs, and that's a real issue. The issue, as I understand it, around uh, age discrimination is that they've basically particularly stated that in their executive order that that it's aimed at youth for children 19 and under, and then so they're essentially denying medical care that's necessary and well accepted. This is not, this is not experimental or anything like that. So that I think is the issue there. And as of right now, I would say, in my opinion, and I'm not going to give legal advice here, so in my opinion, and I urge you to hopefully talk to your lawyers and that kind of thing, but that care should be able to continue right now. Was that helpful, Barb? And are there other questions that I should be
Yeah,
answering?
I think, yeah, we'll kind of get to Q&A. We're kind of, I think there's lots of questions that maybe we can group together. So why don't
Okay.
we pass it over to Drew, and then we will hopefully get to quite a few questions.
Great. Thank you, Martha and Bill and Barb. Hello, everyone. Drew Gibson, he, him pronouns with AIDS United. Want to start off by sort of echoing some of Barb and Martha's and Bill's earlier comments, that really happy to be here with you all and be part of this community, but also understanding that it is a really difficult time right now. And if folks are feeling overwhelmed, that is by design. What the Trump administration is doing this time around is a order of magnitude greater than what they did during their first term, but is essentially what Steve Bannon, one of Trump's former advisors, is called flooding the zone. It's the idea that you come out with so many actions at the same time that you overwhelm people's senses of what's possible and how to respond. And media doesn't know how to react to it. People don't know how to take in all of this information at once. And so you feel like you can't possibly grab onto anything. So hopefully this session will do a little bit to try and unpack some of the actions the administration has taken in the first 2 weeks, that have felt like 2 years. But hopefully this will open things up for folks in terms of knowing what they can do and how they're impacted by the executive orders. So in terms of the federal funding freeze, on January 27th, the Trump administration's Office of Management and Budget issued a broad freeze of all federal financial assistance. This freeze applied to a little over 2,600 federal programs and impacted billions of dollars in essential grants to state and local governments, nonprofit organizations, and those they serve. The stated purpose of the funding freeze from the Trump organization, this is the rationale they were using, was to review all current federal spending to determine which grants and programs violated the recently released executive orders, including the ones that Bill just went over, and to look over financial assistance for foreign aid, non-governmental organizations for issues of DEI, quote unquote, woke gender ideology and things concerning the Green New Deal, and to try and excise that from federal spending. So the funding freeze that was brought on January 27th was extremely broad. It impacted the vast majority of federal funding for HIV-related programming, including Ryan White, EHE initiative funding, programs within CDC's Division of HIV Prevention, Minority AIDS Initiative programming, and the Housing Opportunities for People with AIDS program. Despite claims from the Trump administration that the federal funding freeze would not impact programs that were providing direct benefits to Americans, that was not the case when it was actually rolled out. We know that Medicaid spending portals were down all across the country in the immediate aftermath of this funding freeze, and that a lot of unintended consequences from that were felt for folks' direct benefits, as well as programs that were being directed through state, local, and NGO entities. So on the 29th, so after about 2.5 days of broad panic and folks calling into the members of Congress, the Trump administration rescinded that memo from the Office of Management and Budget, but then further confused things when White House Press Secretary Carolyn Leavitt posted on X that the White House may have rescinded the memo, but that the policy to withhold any federal funding that they viewed as being in conflict with the executive orders remained in effect. So in an effort to try and provide some clarity in response to several lawsuits that had been filed in response to the federal funding freeze, 2 sweeping temporary restraining orders were filed by U.S. District Court judges that instructed the White House to release all the frozen funds and to communicate the order's restrictions to the agencies that received that initial memo, while forbidding the Trump administration from, creating a new memo by a different name and reissuing or adopting things in the directives in ways outside of what was put forward in the memo. Unfortunately, despite the rescission of this memo and the filing of these temporary restraining orders, we are still hearing that a lot of federally funded programs are still reporting that they don't have access to their funds, or that funding is taking longer to get to them than it normally would. And hopefully in the second longer part of this webinar, we'll hear from folks that have been dealing directly with the federal funding freeze and what their experience has been in trying to access that funding. But this is also kind of another example of how, with the Trump administration's actions, a lot of times, even when they fail, they succeed. So even though they failed initially to implement this federal funding freeze, they still created havoc that is leading to a lack of support and funding for programs that they would, otherwise like to not see continued. So it's unclear what's going to happen moving forward. The temporary restraining orders are indefinite. But it doesn't mean that everything is entirely back to normal yet, and we're relying on HIV server organizations and folks that receive these services to let us know when programs are back online, if y'all are having troubles. Also wanted to cover what's happened with PEPFAR and USAID. Bill alluded to it earlier, but shortly after being sworn in, President Trump issued an executive order creating a 90-day freeze on any new U.S. foreign assistance obligations and disbursements. This impacted funding that had been appropriated by Congress, what Bill was talking about with the power of the purse, foreign aid programs, but had yet to be sent out to those programs. About 4 days later, a stop work order was issued by the State Department that impacted things beyond funding that had yet to be dispersed to programs that had already received that funding, and they were told to cease their work until further notice. Secretary of State Marco Rubio later issued a waiver exempting life-saving humanitarian assistance from that stop work order, but that only applies to, in terms of PEPFAR, antiretroviral medications and treatment to prevent mother-to-child transmission of HIV. PrEP for all populations outside of pregnant women was not included in that particular waiver. And we're also still hearing that many programs that use PEPFAR funds are still very unclear as to whether or not they are able to move forward with their services and what services are indeed covered. In the same time that was happening, the Trump administration was going about broadly trying to dismantle the U.S. Agency for International Development, USAID. On January 28th, about 60 senior executives at USAID were placed on administrative leave, along with select senior foreign service officers, deputy assistant administrators, and 8 of USAID's general counsel. Over the next weekend, the USAID website was taken offline, and there were a number of very high-profile attacks on USAID from Elon Musk, who on X or Twitter referred to USAID as a, quote, viper's nest of radical left Marxists who hate America, and a, quote unquote, criminal organization, saying that USAID, quote, it was time for it to die. The next day, Musk posted on X again that he had talked about closing USAID with President Trump, and that President Trump had agreed with him that the agency be shut down. On that same day, Secretary of State Marco Rubio announced that the administration had plans to restructure and potentially abolish USAID, with Rubio taking on the role as acting USAID administrator and naming a Trump loyalist, Peter Morocco, to oversee an agency review and potential cuts. This is this past Monday. The same day, the USAID's offices in D.C. and the surrounding areas were closed, and about 1,000 USAID contractors were locked out of the agency systems. And then last evening, a directive was issued by the Trump administration that essentially all USAID direct hire personnel will be placed on administrative leave globally, with the exception of yet to be named mission critical personnel and core leadership, and said that the administration would be recalling USAID staff stationed outside of the U.S. within the next 30 days and terminating contracts they deem to be non-essential. It is worth noting, to Bill's point around the legality or illegality of these actions, that on Monday, the Congressional Research Service released a report stating that because Congress established USAID as an independent establishment within the executive branch, the president does not have the authority to abolish it, and that congressional authorization would be required to abolish, move, or consolidate USAID. So, as was the case with a lot of the funding freezes, a lot of this is kind of a game of chicken between the Trump administration, Congress, and the courts. And it remains to be seen what will happen with USAID and PEPFAR moving forward. But the plan from the Trump administration has kind of been to come out guns blazing and try their best to dismantle it first, and then deal with legal issues later. And so that's all I have on the funding freeze and USAID. Briefly want to sort of pitch to actions that can be taken. I'll throw it to Bill, who will talk about story collection.
Thanks so much, Drew. So we're doing a number of different things around actions that can be taken. In particular, we actually have put out a survey about the impact of the grant freeze to tell the Hill how to do that. If you're, it's primarily for organizations, but if your organization is likely to be impacted by a freeze or has potential to be impacted, I'm putting it into the chat. And we definitely would like folks to respond to that survey. Similarly, we are going to be working on doing story collections about people and institutions, how they are directly impacted by a freeze. We're still kind of trying to figure out how to get the technology underneath done and make sure that we've got capacity. But I've reached out to a number of groups, including several that are on here right now, to try to move that forward. So keep an eye out in your inboxes when the story collecting begins. We'll be sure to share it with folks. And Martha, I'll send it to you, and maybe we can get it out to the whole group and Barb. So I will just mention, and I saw a lot of questions actually about the Ryan White program and things like that. I think one thing I want to mention around that is that we are continuing the AIDS Budget and Appropriations Coalition and the hashtag Save HIV funding campaign are continuing to press for funding for the Ryan White program, particularly to continue at least at the amount that they are currently slated at. I do know that there is support generally for the program. Last year, we actually managed to get in more forms for organizations, or excuse me, for that the members of Congress decide on funding than even the National Institutes of Health. So we're going to continue to do that work. I will just say I think I put my email in the chat a couple times. I'll do it again. If you want to sign up for the hashtag Save HIV funding campaign, it's really for organizations, but you can email me and I can send you information about signing up. We will
share, we got the information, I think it was shared, and so we will put it in the chat as well as many of the resources, and then we will follow up with participants as well, Bill. So
great, perfect. And then we're going to continue to do Hill meetings. We're also working on doing in-district meetings. We encourage folks to do that, and we'll continue to get information out there. And we are just working to be in touch with grantees. As for Ryan White itself, I think even getting rid of the memorandum, one of the things that is going on is that they are going to continue to do the reviews that have been put in place by the executive orders. So we're going to have to continue to fight those reviews and or to, if nothing else, explain the value of the Ryan White program over and over to these administration officials as well. So all of that's going on as of right now, especially with the temporary restraining order. The Ryan White program is not currently, it should be continuing as it has been. Drew, I'm going to turn it back over to you for any final thoughts, and then we'll go from there.
Yep.
Absolutely. In the chat, just put in an action alert that AIDS United has put together around the federal funding freeze. We've provided an update to the action alert after the OMB memo was rescinded on the 29th, but it is still a great way to reach out to your members of Congress to let them know that this type of action is unacceptable and that we need to protect federal HIV funding as best we can. And also want to flag that AIDS Watch 2025 is coming up for those of us who are in the US. It will be March 31st through April 2nd. It's a wonderful event involving many of the panelists on this call and many of the folks in the audience, and a chance to speak to your members of Congress and develop some advocacy skills and really try and raise the profile of HIV-related issues at a time when so much is going on, and we need to make sure that our members in Congress know that this community will be heard and that our needs must be met. But beyond that, wanted to just kick it back to Martha and thank everyone for being here.
And actually, before we go to our panel, which is the next part of our program, we wanted to go ahead and ask both Drew and Bill, what is one thing you are telling your friends and family who are probably reaching out to you right now, wanting to know what they could do to help both push back against these executive orders, to share their outrage and their disgust, or to be able to support folks that are vulnerable? What is one thing? Bill, you want to go first?
That's actually a really great question. I actually shared information with my sister in Alabama to go attend today's protests for the 50-51 protests, and I do think that that pushback is really important. But the one thing I also will encourage everyone to do is to write your senators, write your representative. Everyone has 2 senators and 1 representative. Take a look maybe at Drew's at the AIDS United Action Alert, and just get in touch with your members of Congress and let them know that this is unacceptable. That's those. I guess that was 2 things, but
That's okay.
That's
All right.
okay. Those are good. Drew.
The thing that I've been stressing with friends and loved ones is that we are 2 weeks into a 4-year fight, and that there is so much information coming at us at once that whenever you see any report that is terrifying or threatening, to just take a second to sit back, sit with it, and see whether or not it's something that demands your immediate attention or something that you can try and internalize and work through and talk to others about, and act on later. Because everyone is going to be coming forward saying that this is urgent, that is urgent, and so much of it is, but we only have the capacity to do so much during our days, and folks are already feeling burnt out prior to Trump even taking office. So making sure that you're doing this work and fighting for yourself and your community, but also, making sure that you're checking in with yourself, so that you're not burning the candle at both ends, and you're able to show up for your community when we truly need you. So take care of yourselves while also working to take care of others is kind of my general MO.
Yeah. Thank you.
marathon, not a sprint.
Yes, marathon, not a sprint. Marathon holding hands. And just also before we go to our panel, I wanted to ask Muhammad, are you here still? I was
Hi,
looking.
yes. Can you hear me?
Yes. Yes, we can hear you. So, we mentioned PEPFAR, and I know that we have a few members of the global community here, but I think there's one specific action item, at least that is related to PEPFAR. If you can go ahead and share that.
Yep. Thank you, Martha. And hello, everyone. My name is Ahmed Mohammed, he, him pronouns. I'm on the Housing Rights Advocacy team based in New York City. As Martha mentioned, we are planning a protest and demonstration tomorrow, excuse me, February 6th at the State Department related to PEPFAR, calling for full reauthorization. Before I speak about some of the details, I'm just sharing a flyer into the chat. We'll be meeting as I mentioned, tomorrow at 10 to 10:30 a.m. at the National Academy of Sciences. So if you're based in DC or in the DMV or can get there in short notice, everyone's welcome to join us. We're doing this in collaboration with our partners at TAG and HealthGap, as well as ACT UP. So we'll be meeting a block away from the State Department at the National Academy of Sciences at 2101 Constitution Ave. About 10:45, we'll be walking over to the State Department to begin our action at 11 a.m. The action includes a rally, so we'll have folks there to speak and chants related to PEPFAR reauthorization, followed by civil disobedience. So folks who are willing to get arrested and have done civil disobedience training with us will be linking arms and blocking entry into the State Department. And so there's 2 tiers of escalation here, and folks who want to participate could decide based on their risk assessment and comfort level which tier they would like to be a part of. I just put my name, email, and number in the chat. Please feel free to reach out with any questions, comments, or concerns. We have bail money to post bail for anyone that's willing to get arrested. And so I'll keep it short. It's going to be a good action that we mobilize folks for. We have press there and folks from across not just the US, but international partners who happen to be in town who will be joining us. If you are based in New York City or the tri-state area, we have 2 buses leaving to go to DC tomorrow morning at 5 a.m. So please, it's open to all. You just have to communicate with me ahead of time, of course, so that we get you on that list. So thank you, Martha.
Yes, of course. Thank you for that. And, we stand on the shoulders of giants, like ACT UP and people that fought for what we have now. And it, feels like we may have to go back. And so I appreciate that. So to get us going with the panel, we have an amazing community of HIV leaders that are showing up at every meeting and showing up in places and wanting to be responsive and responsible to our community. We don't have too much time, so I'm going to stress to our panelists, to keep it short. But I wanted to go ahead and start with our fearless leader for the HIV caucus and have Benita just say a few words to us. And then I was going to ask Tori to respond, especially to what is going on, especially around the trans community. And then we will just keep it going from there. Everybody here will have an opportunity to say something.
Hey, thank you, Martha. I am so excited to see this many folks on here. So let me get busy. Vanita Ray, pronoun she, her, Aya. Yes, and very honored chair of the U.S. People Living with HIV Caucus. First, let me just say the caucus is the national voice for people living with HIV. We strive to make sure that we're at those federal tables, those other tables that you may not could be at or you may not know about. And we are regrouping to trying to figure out our way around this as well and how we best represent you all, especially since healthcare we know is one of the main things. First, our heart goes out to our communities that are under direct threat, our trans community, our gender nonconforming community, our immigrant community, Black folks and women who are being denied bodily autonomy and rights. So we want to say we recognize that you're dealing with way more threats than just HIV, and we want to be responsive to the whole you and not segment you off from HIV. We recognize you're dealing with these multiple threats. I want you all to pay attention to what's important. We've got some toolkits that we can share around National Black HIV Awareness Day with y'all, but where you can use those opportunities to lift this up. We've been a part of the Save HIV funding coalition, but we want you all to listen. Don't just trust your organizations. I'm not as confident about Ryan White. I don't trust these people. Ryan White ain't reauthorized, and it could potentially be something they could cut easily. So let's not be lulled into no complacency with an organization just telling us the information and we go back to sleep. This is not the time to sleep. Service providers, you're on here. This is the time to not just be a pill police for our people and do some voter registration. There's all something that we can do to mobilize our people and get them engaged, because what we are seeing here is an attempt to erase Black folks, it's an attempt to erase immigrants, it's an attempt to erase anyone who isn't white, whatever they classify that as. So we want people to get involved. Do not go to sleep. We will be training and mobilizing our people. and recognize you show up here and you're not just a person living with HIV, you're a Black person, you're a woman, you live in the South, you may be poor, you may be trans, and all of those identities we need to be addressing in this moment. So thank you all, and reach out to the caucus. Someone dropped something in there where you can sign up to be a member. We are getting ready to regroup and think about how do we best represent you, and we are accountable to you, the people living with HIV. Thank you, Martha. You know I could go on, so let me stop.
Yes, we do. I know there were a lot, there's a lot of yeah, there's a lot of concerns among the young, for the young trans folks. There's questions in there about care and access to care and so on. And so I just wanted to see if Tori wanted to share some remarks, comments, and resources.
Hey everyone, and thank you all for inviting me. So my comments are to trans and gender expansive people and also to everyone else. And I will be as succinct as possible. And so what we are experiencing is shock and awe. That's another term. Shock and awe, which is technically known as rapid dominance. It refers to a military strategy that aims to rapidly overwhelm an enemy by using a massive and sudden display of force, causing psychological shock and effectively destroying their will to fight through a spectacular demonstration of power, often involving surprise attacks, sometimes happening on Twitter at 12 o'clock at night, and overwhelming firepower, essentially aiming to paralyze the enemy's perception of the battlefield by creating a sense of hopelessness and intimidation. And that's what we're experiencing. And so because we're experiencing that, it is absolutely important that we strategize and fight against it. And so my belief is that to counteract and to win against shock and awe, that we must stop, breathe, plan, act, plan, react, and then plan yet again. And then repeat the cycle. So the first thing what happens with shock and awe is we have to stop and really process what it is that's going on. What's going on is there are people who are not us, who are attempting to dictate every single part of our life and create a world where only they exist. And that's not what happens in the world. I also mentioned through an email earlier to Vanita that my word for this year is WHUW, exclamation point. And when that came to me, it reminded me that in order to say, whew, you actually have to breathe in and then breathe out. Mm-hmm. And so as a community of people, we've got to do a lot of wooing. Some folks say woosah, however you call it, but we've got to do a lot of breathing because you're only breathing when you're alive. And we're not live, we're alive until we're dead. Also remember this, and this is for trans and gender expansive people, but it's a message that I think goes everywhere. Mm-hmm. We're the privileged ones that are on this call.
Right.
And we're still experiencing pain. Thank you, Kamari. I love you too. And we're the privileged ones. And we're experiencing pain. And so as much as we can, while protecting ourselves, we also have to be incredibly intentional about reaching out to folks who have less privilege in society than we do. That means for those of us who are gainfully employed, who have private insurance and will still continue to get our HIV medicine or still continue to get our PrEP or still continue to get our gender affirming care, that we have to ensure as much as we can that folks who aren't as privileged as us have access to those same things or whatever it is that they need. I make enough money that if eggs were $20 a gallon, I could still go out and buy a dozen. I could still go out and buy some. I don't want to, but I could. But what that also means is for those of us who can afford $20 a dozen eggs, that sometimes it's going to mean that we have to spend $100 on eggs, one for me and my family, and 4 for somebody else in their families or their friends or just for themselves. And so that leads me into my next point. I promise I'm trying to be succinct. That's what allyship looks like. And I am always reminded, and I feel like this is the perfect place to remind people that ally is a noun but it's also a verb. And so, as a verb, ally is something that you do to align yourself with, show support, build up folks who are not you. That means that Martha, as a cisgender woman, allies herself with trans folks, because if they're doing it to me today, they're going to do it to you tomorrow. I don't have a uterus. I've never had one. So being able to bear a child was never my issue. But fighting for the right to people to have bodily autonomy has always been a concern of mine. Because if A. Tony Young decided that you wanted to get pregnant tomorrow, I can't imagine it, but it could happen. But if that was a decision that you made and you and your providers and your family decided that was something you want to do as a trans woman who never had a uterus, I should be able to help you fight. And so ally is a verb, meaning I'm going to fight along with you and I'm going to fight for you when you aren't there. And so ally is a noun, it's a person, it is an entity, it's an organization, it's a movement that stands in the gap for trans people like me, for gender expansive folks, for folks who don't have education, for folks who don't have jobs, for folks who don't have homes, for folks who have detectable viral loads, and I could go down the list. So being an ally means that we are being equitable in the way that we're distributing our funds, in the way that we're distributing our loves and our hugs, our technology, and every single thing else. It means that the people who need the most get the most. That's what equity is, right, Vanita? All right. And the last point I want to make.
Yes, the last point, Tori.
This is the last, I know, because I wasn't supposed to take up this much time.
But it's important. Gotcha.
Okay. So misinformation. I define misinformation. I'm using an I statement here. I define misinformation as when I told you something wrong, but it wasn't on purpose. So Martha, you're going to the store and I told you to go 2 blocks and make a left when you should have made a right. It was a mistake. All right. Disinformation is when I don't want you to get to the store because what you need is at the store. And so I told you to take the Q7 to Manhattan, but you should have taken the train to Brooklyn. I did that on purpose because you weren't supposed to get something and I wanted to stand in the way. And so we will hear, as we've already heard, more misinformation, disinformation today, tomorrow, until the next congressional elections in 18 months and over the next 4 years than we have ever heard in our lives. And so if you really are an ally, in a noun, as a noun. And if you really want to ally with trans people as a verb, then it is important that when you hear misinformation, which is a mistake, and disinformation, which is a lie, that you correct it immediately, on the spot, each and every time. We can't rely on the CDC to data check people anymore. I tried Googling something and it doesn't exist anymore. It's as if the work never existed. And so it is imperative that everybody on this call and everybody that you know, every single time that you hear misinformation and disinformation, that you correct them right there on the spot and put your elbow into it. Don't hit anybody because I don't want you to get sued. That bail fund is for something else. But you have to make sure that they know that you are right and that they are wrong. Each and every, say it with your chest and your elbow, Taylor. I took up very much that. I took up way too much time, but that was on my heart today.
Yeah. Amazing.
Thank you.
Amazing.
Thank you, Tori.
Thank you, Tori. And so, we've got half an hour. I will get through everyone. I want to ask, Strawberry, are you still here? Yes. Derek Strawberry Cox is from DC. And if you're still here, I wanted to give you a minute.
Hi, good afternoon, everyone. I'm still here. Yes, my name is Derek Cox, and I go by Strawberry. I do live here in the DMV spectrum. And just to follow up with everyone, I cold-heartedly agree with everything that was said. Jasmine Crockett, I live and breathe by her right now because she is doing the damn thing. I just want to remind people that, the government works for us, and I know we are scared and we're confused and we look lost sometimes, but we put them in those seats. So I want to remind us that the power that we do have as the people that put them there, and sometimes it is confusing and conflicting, but I want to remind us that we are together, we are a community, and we stand stronger than before. And even though I don't like using cliches, but like they said, the history is built to repeat itself, and we still here. And like you said, everybody on this call right now, right here, right now, a bunch of people here. We care. We're not going anywhere, and we stand to support those. I do have a few places here in the DC spectrum area that that are still helping out with those that want to stay on PrEP or just with the HIV meds. But my fear of saying it out loud is a concern. So I would say just reach out to me through email or on social media, and then I can share that information, because I don't know what's going on right now, outside of, our own volition. But I do have hope for everything and everywhere and everybody. And I do want to show and remind people that we're here and we ain't going nowhere. That's it. Keep it small.
Thank you so much. And that was important. I was worried about that. We're trying to share resources, but we're also trying to keep people safe. Tony? Hey, Tony.
Hey, I hope you can hear me okay. Thank you, first of all, for the opportunity. And I am probably going to have a slightly different perspective than many people. My name is Tony Young. I'm the founder and executive director of Community Education Group. And I'm going to say, I think we're fighting the wrong fight. I believe that one of the things that we need to understand and may want to put into perspective is that at least two of the executive orders really are not even executive orders, because the programs don't even exist around the Green New Deal. There is no such thing. There's a whole executive order that's looking at things that don't really exist. Our reality is that we can't say we've been here. We can't say things like all we got to do is make it to the midterms. We can't say things like all we got to do is make it to the next 4 years, or make it through the next 4 years to the next election. The reality of the situation that we're in is that we have never been in the situation that we're currently in. We have an unelected official who has the PIN code to the payment management system for the United States of America. If this was Africa, if this was Venezuela, if this was Guatemala, we would know what to call this thing. We refuse to call this thing what this thing is. This thing is a coup. It started on January 6th, and it's being implemented today. Now, I know that we are concerned specifically about our HIV, viral hepatitis, and other STI-related programs. But the truth of the matter is that this isn't like just a shock and awe, and we wait. We can't wait. We can't wait because we're in a process of seeing systems dismantled before our very eyes. The actual fact that an unelected official who was not even born in the United States had the capacity to shut down USAID, got into people's email, shut the building down, terminated the employees, and said, hey, you don't have a job and you don't have an agency tomorrow. Now, you can say we're going to fight this fight and we're going to wait to go to Congress and we're going to go get a bill and we're going to do this and we're going to do that. Ladies and gentlemen, I have good news and I've got bad news. The good news is that we might have a shot if the courts hold. But remember, if we go to federal court, right now, Bill and Drew spoke about it. We already have in place an order that says they're supposed to what? Turn on the spigot for all of these federal programs, mine included. So yeah, it's personal, mine included. That spigot has been turned on, but nothing came out. Organizations still don't have these resources. As we're sitting here having these conversations, they're dismantling that system. They've already put together a budget cut document of $1.2 trillion worth of agencies and programs that they want to cut. That document's already there. That document is already moving through OMB. While we're sitting here having this conversation about we're going to go back to court and we're waiting on Congress, and this is not 6th grade civics. And I think I'm in the midst of a panic because we think that there's this system of checks and balances that is going to come to place and come to bear on this process. And we all of a sudden are going to wake up one day and it's all going to be okay because we're going to have gone to court. We're going to have fought the fight. And then people are going to go out in the street and they're going to mobilize. I'm going to tell you what I told a group last week.
And then we'll pass it on.
Huh? Are you going to cut me off?
Yes.
Well,
I love you.
I mean, I think, and I just want to be very clear.
Say it.
I think it's unfair that you're cutting me off at this moment.
No, not at this moment. I'm just saying, say it, and then we'll move it on. That's what I meant, Tony.
Because I think that we're playing this the wrong way.
Okay.
I think we're playing this the wrong way. And I think this is far more serious for an American democracy than it is about my program or your program or anyone else's program. We can't, people want to rely on pharma to come up with the response for programs. We can't. You know, ending the HIV initiative is actually Trump's program. They don't care about these programs. They don't care about the individuals. We have to hope, we're waiting. Everyone's holding on that on February 10th, somehow the spigot for these dollars is going to come back on. But what if it doesn't? What if civil society has been eroded in a way that we can never put it back together again? We're having conversations about going to court and going to Capitol Hill. We have an ineffective Congress at this point. We have an ineffective judiciary because if we even get to the Supreme Court, we know the answer there. We can
So
hope.
Tony, what do we do? Like, for me, that's my question. What do we do?
What we do is realize that the moment that we're in is honestly gone. I've suggested it to many people. I think that what we need to do is that we need to come together as organizations, not to have dialogue like this, but to have a strategic planning conversation, because we're all not going to be here in 6 months. So who's going to survive? We have to have agreement on who's going to survive. We have to have agreement on who's going to be here to do the work. And we have to have agreement on how they're going to get paid to do that work. That's the conversation we need to have with an O'Neill Institute, an AIDS United, an HRC, a SAC, a CEG, a NASDAQ, a STI Coalition, a Pharma, a Gilead, ViiV, Merck. We need everybody, probably 20 or 30 organizations in a room, and say, here is how we're going to survive this and take care of people. This is the only way it happens. It doesn't happen with all of us surviving because we won't.
Gotcha.
Because we won't.
Gotcha. No, I'm absolutely, and that was the desperation. Like when we're trying to get this, people were asking, where is that conversation that you talked about? Where is it happening? And
it's not. And we have,
not.
and I mean, and literally we're asking Merck, we're asking ViiV, we're asking Gilead, we're asking AbbVie to come together. And I'm going to be very, very transparent. Some won't agree with it, but I believe the O'Neill Institute is the best moderator of it because they've got less skin in the game. I think that the reality is that we can then come together and say, listen, here's who, if it's going to be key population specific, if it's going to be domestic versus, how are we going to survive? How are we going to be here to be able to provide care? Maybe CEG isn't here to provide services in rural communities. Maybe it's somebody, maybe it's a National Rural Health Association. Maybe they've got the capacity to do it. But the reality is that if that spigot doesn't turn back on, because it's not just HIV programs, it's the Appalachia Regional Commission too.
Yeah.
It's job programs too.
Well, we got you. And I mean, we're leading, I think Drew talked about AIDS Watch is a place where we all somehow going to gather. And I think what you're saying, and I think it can be an action item for after this, is we need to start strategizing around that meeting. AIDS Watch has its own agenda, but I hear you with the strategy. Because
and a sense of urgency. I think that we keep thinking we have time that we don't have.
Okay. All right.
We keep thinking we have time we don't have.
We hear you. We hear you. And this is what we've been sensing. So you've brought it up to the core and we hear you. And I really appreciate what you've said. I'm going to ask Barb to come on up. And we have a few more people. So Barb, are you still here?
Yeah.
Yes.
I am.
Yeah.
I am. Thanks, Martha. And thank you, Tony, for bringing the fire and actually really lifting up what the sense of urgency that so many of us are feeling. I'm just going to go ahead and say Barb Cardell with Positive Women's Network. While we say this is a marathon and that we need to take care of ourselves and hydrate and all of these other things, we also need to know that our lives are at stake. And not just the lives of people living with HIV, but when we talk about the people that the Trump administration wants to erase, we are talking about Black and brown bodies. We are talking about same gender loving folks. We're talking about transgender folks. We're talking about youth. We're talking about immigrants. We are talking about people who are most impacted with HIV, who were first to be erased. And that is the violence of this system. And so if you're not feeling a sense of urgency within this chaos that is intentional, but if you're not feeling a sense of urgency, you're not paying attention. And we need to know that collectively, all of us needs to be paying attention and needs to be acting now. And we need to be acting now in ways that are strategic, both within our own communities, but also at the federal level. So we need to partner up, we need to group up, we need to figure out what we're going to be doing. I love the fact that we talked about the 50-state protest, which is today. It is 50 states protesting in 50 capitals against Project 2025, which is the roadmap to what they have been doing. And so when we think about how we show up and how we coordinate our thoughts and how we really mobilize, we need to make sure that we are being vocal and strategic, and that we have that sense of urgency. So with PWN, we have been really sharing with our members a number of newsletters responding to both people's sense of concern within this chaos, trying to share information, and also giving them opportunities to be able to join these protests, to have their voices heard, to come to AIDS Watch, and to feel coordinated. I'm going to go ahead and share in the chat once I move on to the next person, our monthly policy update. If you are not a member of PWN or an ally, sign up and get this letter. It is a chance to really kind of follow along with what we're thinking about as we are looking at this current sense of urgency. But I'm going to end my comments with one last thing, which is that we do not comply. When we're talking about the impact on transgender youth, gender affirming care, so many hospitals have actually said, oh, well, they've threatened us, and so we're going to go ahead and stop providing services. We cannot comply in any area, in any form. We must disrupt, we must protest, we must not be complicit in the work that this government is doing, because they are not valid. And if we are waiting for other pieces of this government to step in and stop what is being brought forward, we know for a fact that people are going to give this current administration leeway and time to work it through the courts, and we do not have time. And that is the one piece I hope you all can take away, is we do not have time. Our communities, the people that we love, our allies, our accomplices, people we are with, we do not have time. We need to act now. So I'm going to stop there, and I'm going to actually pass it to the next person who is here. And I'm going to share with, actually, Malcolm, do you mind going next and talking a little bit about both what you see and how you see people engaging?
Sure, thanks, Barb. Hi, everybody. My name is Malcolm Reed, he, him pronouns. I am the Policy Action Committee chair of the USPL HIV Caucus. I also just recently started my own company called Unity Arc Advocacy. And you know, I so agree with Tony. One of the things that has frustrated me is that we keep moving in this O.J. Simpson slow speed chase as if everything's going to be all right. when you think about the fact that January 6th was 4 years ago, and it has taken 4 years of delay and BS to get through the courts and all of these things that the current president did, it took all of this time for that to get through the courts and for him to get convicted. And even when he was convicted, he was still elected. And it points to the fact that in this country, we are so comfortable with believing that it can't happen here. We look at the news and we see all of a coup over here and a coup over there. Oh, that can't happen here. It's the United States of America. It is happening here. And so I think we have to advocate, agitate, and educate. One of the things that I've always said is that people go to the polls, but they don't know what they're voting for. They don't know how the system works. And they will believe anything. So many people said to me during the election time, oh, Donald Trump said he don't know what Project 2025 is. And I'm screaming, the man is a liar. You know he's a liar. Why are you believing what he says? And so now, when all of this is happening, they're all looking around going, what the hell is going on? Excuse my French, I'm gonna be clear with what everybody's telling me. What the fuck is going on? We told you what was going on. I told you to read Project 2025, where in, I can't remember what page, but it specifically says there will be pushback. Ignore them. They know the plan has been there. If you read the forward for Project 2025, it says this started in 1980. All right. So this has been the plan for a very long time. And if we wait for it to wind through the courts, who knows where we'll be? And I don't have the answers, but I do know that we have got to be more aggressive. You know, this is no time to, okay, if I say something, they're going to come after me. They're going to come after you anyway. They're going to come after you on social media. They're going to come after you anyway, any way that you do. So get out there and fight, protest. One of the things that I'm doing at Unity Arc is I'm talking to people who were formerly in the Thrive Network and trying to put together some education programs about this is what's going on. They said that they were going to turn off TikTok and everybody went crazy. And then Donald Trump turned back on TikTok. Isn't that great? Donald Trump turned back on TikTok to keep you distracted so that you wouldn't know what the hell was going on. And y'all out there playing on TikTok. Meanwhile, you might not be able to get your medication. You might not be, your mom's Social Security might go away. Hell, my Social Security might go away. I talk about Social Security like I ain't got gray hair, but we have to make sure that we are much more aggressive. I agree with Tori. We have to relax. I wrote something, I started meditating and I wrote something about returning to the breath and being calm and using that to strengthen. And yes, we have to do that too. But you know what? I wish I could be in DC tomorrow. I wish I could be in all of these places because I grew up in the 60s. I grew up in this. I know what protest looks like, okay? And we have to get back there. We've gotten comfortable and complacent, and it's time for that to end. And I'll just stop there. I don't know who's next. I'll pass it to who's next on my screen. So I'm going to go to Larry.
Thank you.
Yeah. Larry.
Wow. Just wow. I wanted to stop first just to take a breath to acknowledge the still over 700 people in the room and that we are all connected, whether we know it or not. So I'm Larry Bryant, 39-year survivor, he, him pronouns. I'm the senior program coordinator with the Reunion Project. And we are encouraging our networks to stay connected to each other, particularly older folks living with HIV. Um, we know how isolation works, and we know how isolation and oppression combined with all of the other crap that's going on now is a diabolical destruction, particularly for someone who's living with depression and anxiety like I do. So we need to check in on each other, check in on ourselves, and don't be afraid to reach out to people you haven't heard from in a week or two. They might need to hear from you. We encourage our networks to find ways to gather, not just online, not just virtually, certainly not just on social media, but in-person ones, like the ones that we do. We have a two-day event at the end of this month in Norfolk, in the Tidewater area. So we encourage people to stay connected, find gathering places with people you trust, um, connect to trusted communication and news sources. Become familiar with Signal. Try something else other than TikTok, other than Instagram, but again, ways and with people you trust. There's a lot going on. There's probably, I don't know, by the time we end this call, we might see another headline on the news. But we must, and I agree with everyone that has preceded me about the urgency of the moment, about the uncertainty of what's about to come. But we know we can control as much as we can control, but we have to be in the game to do it. We have to be connected, we have to be present, we have to be resolute, and we have to be supportive of one another. I'm going to go back to the allyship that Tori brought up earlier. We can't just talk about it. This is it. We have to be about it. We have to be present, we have to be visible, we have to be productive, and we have to be, again, willing to overcome our own insignificant biases to work with every other person on this screen. Things that we haven't done successfully or always effectively over the last 20, 30 years. We need to do that. We have set up multiple models of how to collaborate, of how to fight, and how to win. We know how to do this.
Yes.
Thank you, Larry.
Thank you, Larry.
Yeah. And we'll go ahead and go to Tammy next.
Thank you all. Hi, everyone. Tammy Hott, she, they, co-executive director of the CERO project with Kamaria Laffrey. And CERO is an anchor network of the U.S. People Living with HIV Caucus. All of the cuts and executive orders out right now are going to heighten stigma and criminalization. Being fear isn't helping, but mobilizing and listening to one another can help. Although we want to share we were asked to share a few of the things that CERO has to offer to the community. After hearing previous people speak, I don't know if this is enough. And I hear from Tony Young the urgency and also wanting to support that and figure out how we can collaborate together to make that happen. But in the meantime, CERO continues to support state coalitions, including hosting strategic planning in several states. We feel a lot of the work, especially HIV criminalization reform work, has to be done at the state level now more than ever. And we are bringing back at the end of this month our community conversations, providing an opportunity for advocates to share successes, challenges, advice, and just a time to get together to discuss what's going on and how we can potentially deal with it. Also, with our partner organizations, the Positive Women's Network, the U.S. People Living with HIV Caucus, and Positively Trans to host HIV is Not a Crime National Training Academy, which is May 31st through June 3rd. HINAC is a space where we want to carve out meaningful time for the community to share ideas and strategies for the years ahead. We aim to continue to be able to provide opportunities for the community to meet and share ideas and support. Thank you all.
Thank you, Tammy. Really appreciate you and the Zero Project for your ongoing work, especially as we think about criminalization and keeping our communities safe. We have just a few minutes left in our webinar, and we wanted to see if there were one or two questions that have come up in the question and answer that we might want to get some comments from our panelists on. And checking to see, Eric and Kelly, has there been a couple of recurring questions that we might want to address?
I am seeing a couple of questions around hearing more from Tony and sharing Tony's contact information. There's questions around how we can do better to show up and protect the trans and gender diverse communities. And some questions around what kinds of actions we can take. So I'm seeing questions around protesting, civil disobedience, direct actions, and trying to assess what is the most strategic actions at this point.
There were some questions earlier related to Medicaid and, just, generally, if people face, still facing a lack of access to Medicaid. I think those may have been addressed but we'll continue to collect those.
Just on Medicaid, I will just say there is going to be a massive fight on reconciliation. They're going to attempt to use reconciliation to try to cut as much as $2.3 trillion out of the Medicaid program. That would really, I think, cripple it in some states for sure. And I think it just means people would not have access. So one of the things that people I'm going to urge you to do is to, when we have fought this fight before and we've won it in the past. So I want to point, just make sure that when you start seeing stuff about Medicaid coming out on the lists and from your organizations, get involved with local organizations that are also in touch with DC. Please be really aware of that and mindful, and let your members of Congress know that you do not support those cuts. That's going to be a real massive congressional fight that's coming up in the next couple of weeks.
Okay.
And just one, can I, Martha, if I could, we have a call on, I believe it's on Monday. And I think that they're putting it in the chat. Lavina just put it in the chat.
Okay.
Feel free to sign up for that. And you can also get my contact information. It's T Young, T is in Tony, Young at communityeducationgroup.org, and go to our website, communityeducationgroup.org. Thank you for the opportunity. I've now got to go get a copy of my birth certificate. I'll see y'all later.
Thank you. I wasn't sure if Sophie was still here. I can see her square. I know we talked about PEPFAR earlier, but I think.
And we also have Malcolm's hand up too after this, Martha.
Okay. Yep, and then we'll wrap it up. We'll just ask for a few more minutes. We still have over 600 people here, so we'll still have a few minutes. Sophie?
Great, thank you very much. So thank you for this incredible webinar. This has really been a very powerful discussion. It's been amazing to hear from everybody. My name's Sophie Brion. My pronouns are she, her. I'm the Director of Global Programs for the International Community of Women Living with HIV. And it's hard to overestimate the devastation that is impacting networks of women living with HIV around the world. During this 90-day pause and the lack of clarity, even around the delivery of essential medicines that are needed. And one of the things that I think has been, that I'm taking away from this call is this, there's been some discussion at the global level that, everything will be a bit more clear in 90 days, and then we'll know what to do. In 90 days, we'll find out what the shape of US foreign aid will look like now, and we'll be able to, make some decisions, and we can, start to fill the gaps in funding and respond to these gaps. And I think I felt it was short-sighted when I heard some of these comments coming from different folks. And it sort of has galvanized this sense of urgency. Even when US foreign aid comes back online in 90 days, so many essential things beyond biomedical responses may not be available, right? We won't have community-led monitoring. We won't have support. We won't have anything to support vulnerable communities. And I think we really need to take advantage of this moment for global solidarity. We need a global day of protest. We need people in the streets around the world. This is, a massive situation that requires an action. And I really want to thank everyone for the clarity on this call and for the purposeful call to action. And I know there are a number of activist calls happening that are sort of ongoing in parallel. And I really hope that as the calls of you powerful activists in the United States, we can connect with activists around the world and really make sure that we are acting together. Because I think what's next is, that we will ourselves could descend into chaos, right? They'll start to become, fights for resources. Organizations will collapse. We won't have solidarity. So the points that were made by Tony and also by Tori about how we need to plan and we need to organize and we need to take collective action are just so essential. And so I thank you so much for this, and look forward to how we can all work together for global solidarity, defending the right to health, defending reproductive rights, defending trans rights, defending all of the people that we love around the world. So thank you, and I'll end it there.
Yeah. Thank you so much, Sophie. And, we had spoken before. I was kind of short-sighted, naive in the beginning as this was happening, not knowing how it would quickly become a global catastrophe. And I really do agree. And I love that idea of a global day of protest everywhere. If we can coordinate that and show up strong. And so, we'll see what conversations are happening with A. Tony Young, and we will also, as the caucus, as networks, hopefully it's true, it's a time to act. We feel the urgency, and we do need to do what we can do now. We cannot wait. One of the things that I think we're very conscious about, and I only say this just to put a quick plug in for Positive People, is people's safety. In 2016, Positive Women's Network created safety pods for people to be on WhatsApp and be on place, where we could report, flag any activity, report if you feel you're in danger. After what Tori said, it's hard to believe that this is the day we are in, and the allyship and safety nets and our own safety is critical. I had suggested when I was communicating with the panelists that maybe we would start a Google group. Bill very gently and cautiously said, we need to stay off of some of these places. Strawberry was even afraid to share of locations. We have ICE going to schools, to ADAP, pharmaceutical locations. This is a time to be safe and to really be an ally to those who will be less safe than some of us. And so I really want to emphasize that, even as I share that, the reason Positive People was kind of created was, to be a safe space initially for women living with HIV, fearing violence, stigma, trauma. And we have absolutely let go of that and expanded this space for people living with HIV. This is being treated with the seriousness that it deserves. It's backed by a very, two big organizations that host, HIV servers and securing this. And so this is a place that you can go create your own community, create a safe space to ask questions, share resources, And, to the best extent that we can compared to Facebook and Twitter and social media, we're going to try and keep this safe by screening. If you click on that form, we are absolutely screening and verifying that the people who are getting on this are only people living with HIV to the best of our ability. So it is an option for a safe space, for a place where you can find community and know that the people you're talking to are only people living with HIV. And it's just launching, but we can create it to be the safe space that we want it to be. We'll share those. I want to thank you for those that stayed until the end. I'm really grateful to our panelists. I feel like, you showed up for our community, you showed leadership, and we sense the urgency. And together with our partners, AIDS United and all the global organizations that was mentioned, FAP, other places, the Collier Collective, we'll get all the resources that we can, share them, and get people to share stories and mobilize. And I feel like pretty soon here, I think we're going to have some amazing form of civil action and civil disobedience if it's needed. And we feel like it is. So we're going to be allies to our family, and we're going to act. And so I'll do my best. I mean, we have a list of over 100 people that registered. To the extent that we can, we will share all these resources, all the things that were shared back to you as a follow-up to this webinar, so that you can become connected to any network and any form of action that is happening. Don't forget AIDS Watch, which is a family gathering coming up in March. That's where we are all assured of being and doing the best that we can to advocate. I thought I heard somebody say something, but thank you so much. And I will let you all go to your amazing and important lives. Thank you for being here. And thank you to all the esteemed panelists. Drew, Bill, thank you so much for setting the stage for us.
Everyone be safe.
Yes. Everyone be safe, please.
Thanks, everyone.